Hi, good morning to all. My name is Merlin, and thanks for watching and sharing my videos yesterday about autistic spectrum disorder. And I want to continue today. Is the ADHD, attention deficit hyperactivity disorder, is genetic or hereditary? See, same like a autism disorder, we always heard, oh, this child is having ADHD, attention deficit disorder, or he is not concentrating, she's not concentrating. He, doesn't apply what we teaching them, or what we saying. He's not, obeying. He's not following the directions. We always say. So in case, you know, uh, if you are in a doctor's room for or going to see the doctor's appointment for the evaluation of your kids attention deficit evaluation, so we have a lot of thinking in our mind, even parents thinking how, you know uh, how the ADHD transmitter, whether it's a genetic transmission or is hereditary. They have a lot of questions in their mind. Of course, the doctor gonna say you, after evaluating the child and confirm your child having ADHD, attention deficit hyperactivity disorder, the doctor gonna say to you, the doctor has to evaluate the parents first, and through the questions, through the assessment, through the history and the physical examination, the doctor analyzed, the doctor evaluated, and finalized that the parent were, having ADHD, and it is genetically transmitted to your kid. Of course, if the clients or the parents coming and approaching us, my child is having these symptoms, and finally the doctor assessed, oh, your child having ADHD, and second question, suddenly the parents asking to the doctor, how is transmitting, or what is a transmission or a cause. Of course, the doctor gonna say answer is a genetic transmission from the parents to the kids. And of course, we know it's a neurocognitive or neurodevelopmental disorder. It's affecting the brain, usually having the thinner brain who getting, the ADHD, higher chance. And there is a dopamine, which is increased level of dopamine in the brain. That's it. It causes ADHD. So as I said, you don't have any more questions in your mind if you're thinking about ADHD, how it's transmitting. It's of course truly ADHD is hereditary transmitting or through the genes from the parents to the kids. And it's a neurodevelopmental disorder, and it's a mostly common diagnosed in the childhood, in the early childhood. We're getting a lot of cases in our, even the schools, in the community health centers, or in the special education centers. We have a lot of cases having the ADHD, attention deficit disorders. And we always think about, mental disorder. We think what are the signs and symptoms. Of course, ADHD is a mental disorder. Some clients, some parents asking us whether this is a mental disorder or something else. Yes, of course, it's a mental concern or mental disease, as well as it is neurodevelopmental disorder. The signs and symptoms of this ADHD, attention deficit disorder, hyperactive disorder. The first thing is, if you look at the child, if you look at the child who is suffering from this disease, he or she is inability to focus. He cannot able to follow our directions. He cannot able to focus on one thing, focus on one object, inability to focus. And the second thing is, we can say the avoiding task or not able to complete them. Something, even in the adults or kids, we giving to complete one task, or we going to giving the toy or something like a blocks or something. We asking the child to complete the task, and he couldn't or she couldn't able to complete the task because they having lack of attention, they having lack of focus. And um, and the third thing, the main thing is, they being easily distracted. They don't have a proper concentration, they don't have a proper attention, they're having attention span is too less because their brain were thinner, and dopamine levels so increased, and what happened is, they easily distracted, and lack of attention, lack of learning, and lack of focus. These three things is the main signs and symptoms of those who affecting with ADHD, even in the adults also, even in the child, you know in the child ages. So researchers, as I said always yesterday, the research is still continues, and some research suggests that the gene is the largest factor determining who develops ADHD. The genes is a main factor. Gene. Some saying environmental, biological, hereditary, but the research suggests the gene is the main part of determining who develops the ADHD. And as we all know, genes are the building blocks of our body, right? So, how we transmitting the genes? How we getting the genes through our parents, right? So, of course, this genes or this, you know, uh, genes is transmitting from the parents to the kids. So that's why I always say ADHD is hereditary. Through genetic is transmitting from the parents to the kids. So the doctor needs to evaluate the parents first after they finalize this kid having diagnosed with ADHD. So we say, normally identical twins, right? They always appear like each other same, and their parents same, their birthday same, of course, when going to the school they are in the same classes. Sometimes if the parent having the identical twins, they born together, right? They also share the risk of having ADHD. I mean, the both can get a chance of getting ADHD. The identical twins who born from the parents who having transmitting the genes, and they share the risk of having ADHD. It's a higher chance of developing the disorder. That's the risk chance. And what I say, and there are some additional risk factors also, like environmental exposure, like exposure to the leads may increase the chance of like a child who is affected with the ADHD. Of course, the small number of children who getting like a traumatic brain injury, those who having the traumatic brain injury develop ADHD. And some researchers suggest that the mom who smokes or smoking, who has a habit of smoking while she pregnant, having the higher chances of the child getting ADHD, and the babies before their due date or the premature babies having the higher chances of getting ADHD. Okay, as we always say, we have early interventional methods and early special education, early evaluation. So the early prevention always prevents the complications. So if you're thinking that your child having these signs and symptoms, or you having this risk, or you having these hereditary, problems in your childhood or something, suddenly what you're gonna do is you need to consult your child in a pediatrician, and the pediatrician going to evaluate your child first, and if they need more evaluation or the deeper evaluation, they gonna consult the doctor, child clinical psychologist or neuropsychologist, and they will do further evaluation, and they will diagnose the child having ADHD, and they do not, going to treat according to that. They through the observation, direct behavior, observation, psycho methods, then behavior therapy, talk therapy, and they have a lot of art therapy, and they have a lot of steps and going through the interventions, and they will do the treatment. So what we're gonna do is, as a parents, as a friends, as an aunt or uncle, as a neighbor, as a family member, what our aim or what our responsibility is to share this news to the world and prevent the complications. As I always say, as I said yesterday, children is precious, and the generation is precious. We need to modify their character, modify their behaviors before it going to be a complication. So, if he having the chance for, you know, if he getting um, or if we seeing some childs who having these signs and symptoms, suddenly what we're gonna do is we need to tell the parents or tell the family or tell the relatives or whoever it is in community or remote areas. We need to advise them. You need to consult your child with the child doctor, and they will do the further evaluation. Thank you so much. Thank for watching the video, and please continue to watch, and have a nice day to all.